Hi, TAP family. Thank you so much for joining us again. Tonight, we've been doing a lot of virtual events, so hopefully we're getting a little bit better at this live stream thing. Tonight, we're really excited to welcome Dr. David Shih. He likes to go by Dave. He was previously featured actually in TAP New York's Spotlight series. He's got a great repertoire. He was formerly an emergency medicine doctor at Northwell, then was a co-founder at CityMD, which a lot of you know. Probably seen around in the city if you're based in New York. And now he's actually the chief medical officer for RendrCare, which he'll talk a little bit more about. He's also a CEO and founder of Master Clinicians, which is sort of an educational company providing CME conferences, podcasts, et cetera, for other physicians. But today I'm excited to bring him in to be able to talk a little bit more about, what exactly is the coronavirus. You're probably reading a lot of news on it, and Dave has been posting on his Facebook, just helping people sort of decipher the different things that they're reading, but also his experiences. He oversees and cares for a huge community of actually Chinese patients in New York City. So very relevant for a lot of us in TAP New York, and then, in the other cities that you're coming from as well. So excited to hear a little bit about his experiences. And then lastly, what to do to protect yourself as well as others. As we know, we're probably still in the calm before the storm maybe. So it'll be good to hear a little bit more from him in terms of what's to come maybe, and how to best protect ourselves and our communities. So with that, I'll turn it to you, Dave.
Thanks, Julie. It's an honor to be here and talking to everybody. Maybe a little bit about my background. David Shih. I'm a ER physician trained in Northwell, North Shore LIJ. Worked as an ER doctor in Huntington Hospital for, I think, about 8 years. I was the overnight doc there, so I miss my ER team and friends there. Shortly after, I was very fortunate to be part of a group that helped started CityMD. It's around 2009, 2010. And we just kind of fell into it, and it was just kind of the right mix of people and the right timing. About 2 years ago, I left CityMD for a lot of, personal issues, health issues. That was, I guess, highlighted in one of your articles. And since then, I've been trying to, find some work to do. One of which was I started my own CME company, which is a continuing medical education for clinicians. It's called Master Clinicians. And we focus a lot of things on podcasts and online tutorials and also live events. Certainly with the coronavirus, a lot of my live events are canceled for this year. That's part of the unfortunate aspect of this crisis. And then the other thing The other thing I've done is very fortunate to be the chief medical officer of a new primary care practice called RendrCare. RendrCare was started earlier this year. It's a group of 17 practices in the 3 Chinatowns of New York, in Flushing, Queens, in Chinatown, Manhattan, and Chinatown, Brooklyn. 17 practices, about 28 locations, and I think 70 providers, PAs and docs. We serve about 85,000 patients, predominantly Chinese. So, who knew starting another new company and starting another new venture, another new practice, the first thing we get hit is the coronavirus. So I've been dealing with the coronavirus since January. And one of the things that we were very nervous about was the Chinese New Year, when a lot of the students and a lot of the family members went back to either Taiwan or China. And then they were coming back, and we were starting to hear more about this. And so we started preparing. So that's RendrCare Physicians. And I guess that's a very short summary of kind of what I'm doing. You can find more stuff, I guess, on my Facebook and my LinkedIn. So maybe I can turn to the slides. I think what I wanted to do today, maybe spend half an hour sharing some of my insights and talking a little bit more about the coronavirus, answer some commonly asked questions in my slides, and kind of get people to understand what the heck is the Surgeon General and Dr. Fauci and the president talking about, and then maybe answer some of your questions afterwards. And so we'll see. Let's see how it goes.
Great. All right, I'm gonna turn over to the slides then.
Okay, so let's see. You guys see the slides? Yeah. Okay, so today we'll just talk a little bit about updates on COVID-19 coronavirus, and so I think one of the first thing I did as when this came out was really kind of explore how do we examine an infectious disease or a pandemic. Being in the ER and being in urgent care, I certainly have seen my fair share of infectious disease. When H1N1 came out, that was quite nuts. The swine flu, and I remember taking care of patients in the ER, and I remember taking care of patients in the urgent care, and there was actually a lot of people sick and a lot of people very nervous about this. This was around 2000, 2009. Actually, the beginnings of CityMD grew from kind of that crisis. And then I remember going through the Zika crisis, and remember going through the Ebola crisis. And as chief medical officer, I had to figure out what to do, right? And then we also had measles outbreak in New York City, and I think a lot of people don't realize that the reason why some of these things are higher in volume, for example, measles, is because at CMD we're able to diagnose a lot of them, and we work with the Department of Health. So I have a good relationship with the Department of Health to identify a lot of these cases and track them. Same thing we did for Zika, and we did. I remember when Ebola was an issue. That was something that made us all very nervous. And I remember we had one potential case at one of our sites, and we had to shut down the site because we thought maybe that was a positive. So I remember going through all those times, and certainly it's very normal to be fearful and panicky and scared about, how do you view a disease, right? Because we've all seen movies and we can get very nervous. So um, I wrote something a while ago, which I guess people really like. There are three things essentially to look at when it comes to infectious disease. So the first thing to look at is the volume. How many people are affected? I think that's important to take a look at. The second thing is the mortality rate, or what they call the CFR, the case fatality rate. And then the last thing is something called the R naught, which is a contagion factor. So these are kind of the comparisons. If you look at the mortality rate of the flu, it's actually pretty low. It's 0.1%. Whereas SARS and MERS is Middle Eastern Respiratory Syndrome, which you also have to deal with, and Ebola, these are fairly high, right? If 1 to 3 out of 10 patients you see, that 1 to 3 or out of 10 patients that have this will die from it, that's pretty high mortality. So that's the second thing you have to look at. The third thing to look at is the R naught, which is basically a scientific term for contagion factor. And what that means is if one person has it, how many other people will be spread it to? So this is something that is important to look at to see how fast it spreads. And in the past, the flu has had a factor of about 1.5 to 2. It means that if someone has the flu, he most likely will spread it to 1.5 to 2 people. Ebola had a R naught of 2. SARS had a R naught of 4, and you can see mumps and measles are very contagious. One person with measles or mumps can spread to 10 to 18 people. So, um, so it shows you that mumps and measles are actually a lot more contagious. Ebola, the reason why Ebola is very deadly, but the reason why Ebola has a contagion factor that's low is because it kills you so quickly that you're dead before you can spread it. So something that's actually super deadly uh, may not spread as quick. And if an R naught is less than 1, then the disease will burn out and die, right? Because if you're spreading it to less than one person, the disease will just eventually fade away. So these are kind of the three things to kind of keep in mind when you look at a disease. And so I remember the first month I was trying to figure out, well, what about coronavirus? What's the volume, mortality, and R naught? And it was hard to get that data, but initially the volume was very low. But now, as you can see, it's infected over 380,000 people, so it's growing. The mortality rate is also very difficult to figure out because it's usually something you calculate after the fact. But right now, you have a death. You have 16,000 plus people dead from COVID-19. If you use the 380,000 as a denominator, then it's 4.3. But we know there's obviously a lot more people infected. There's a lot of people who are asymptomatic or mild disease or lack of testing. So the infection is probably a lot more, and the mortality rate is probably a lot lower than 4.3. It's probably more like it's probably more like 1% if I had to guess. But we don't know until later on. But right now, there's a lot of people dying from this, and then the R naught is something that it's also hard to figure out. But the estimate right now, it's probably anywhere between 2 and 3, and it's very contagious. That one person will spread to 2 or 3. So that's kind of the simple baseline facts right now. And if you look at the world, China obviously was the first epicenter, 81,000 people, a lot of people dead, 3,200, about 3.9%. Italy is, these numbers are not new or not updated, but Italy has certainly a lot of people infected, but a lot more deaths. Um, United States certainly is rising, 43,000 and only 550. So if you look at this, you're seeing kind of the death rate is all over the place, right? And if you look at some of the other countries, same thing. Spain, 35,000, but a death rate of 6.5. Germany tested 29,000, but death is a lot lower. Same thing with Korea, but then Iran is higher. So, what do you make of this? Like, who's right and who's wrong? Is there multiple strains? Um, what's going on? And so, and if you look at New York is rising 25,000. There's about 210 people last I saw. And it's basically the epicenter of the coronavirus right now in the US. And I think it's more than half of the cases right now. So, this situation continues to evolve. And, you're getting a lot of different numbers, but the question is, how do you make of this, right? And there's a lot of different reasons. But if you put it on a graph, and I got this from somewhere, you can see that some countries continue to go up, and they're just basically rising, and their cases are doubling, or they're doubling every 2 days or every 3 days. And then there's some countries that have kind of leveled off, and they're not they're not rising as much. Right? Now, with any stats and statistics, there's different ways to change it and gain it. Um, so you can see that different countries are handling the cases a little bit differently. But you can see that U.S., Spain, United Kingdom, certainly, and certainly in a lot, and a lot of Europe are certainly their cases are growing. They're doubling every 2 days. And then some countries like Korea, Japan, Singapore, Hong Kong, they've leveled off. So what is the strategy? What do people do, right? So I'm sure some of you've heard this. The first strategy that people talk about is containment, and there's some sorry, that should say three key steps. The three key steps is identify, inform, isolate, right? The goal is, while the numbers are low, identify who these people are, inform the government, inform the health facilities, and then you isolate them. And so I think because a lot of the Asian countries had to deal with SARS before in the past, they've kind of nailed this down. They've had their tragedies in the past. So they were able to screen a lot of people. South Korea screened a lot of people. Same thing with Taiwan and Hong Kong. They screen a lot of people, and if they find somebody, they isolate them immediately, quarantine them, and so they've done a great job with these kind of three key steps, and that's the containment strategy. So when or how does a containment fail? Well, it fails because sometimes people just ignore the data. There's a lack of urgency or awareness, or in our country, in our country, there's also a lack of testing. We're out of, we didn't have the proper test at a longer turnaround time, and we didn't have the tools involved, even now. So what happens is that when containment fails and now infection spreads, the result is the curve will start to rise very sharply, and you have this doubling effect, and it starts to be kind of an exponential growth. And the reason why it grows so quickly is because there's no vaccine and there's no herd immunity, right? The difference between the flu and all the other disease is that there's herd immunity. So, with swine flu and with these other, with measles, they don't grow this quickly because there are people who've had vaccine, the majority of the people are vaccinated. And so it just doesn't grow and get to that level. So this is kind of what you get when you have a disease, and we forget this. This is what you see when you have a disease that we have no vaccine for. So that it grows really quickly and it spreads. We have no immunity to this. So and if this disease is very contagious, which it's shown, it has a higher R naught, then it can spread very quickly. So some of the countries like Italy, Spain, and U.S., I think it's fair to say that containment has failed. And then so what they're doing is something called a mitigation strategy. And then so I don't know if you guys heard what mitigation strategy, and I'm sure everyone's heard of social distancing. And so I never heard of that term, social distancing. Didn't know what that meant, but that's exactly what is going on right now. That we need to prevent large crowds, right? And I saw this. I thought this was pretty funny. I saw this as a meme. So this is the social distancing world champion. You want to distance yourself and really not be next to anybody, right? And so this way it doesn't spread. Um, and so, and why is that important? Well, if you think about a hypothetical scenario, this is a hypothetical scenario. Hopefully, this will not happen, but it can. And I think this is what people are worried about: is that you have the U.S. population at 330 million. If 10% of the people are infected, that means 33 million. If 15% of the people are hospitalized, which is kind of what's going on right now, 50% people hospitalized, that's 5 million patients that needs the hospital, which is quite a lot. And if this death rate is about 1%, that's a lot of people dying, right? And so right now, if we're calling today day one, I believe today's infection rate is around 50,000. Infection total is about 50,000. So if it doubles every 2 to 3 days, uh, within a month, this can grow really quickly. Now, there's a lot of assumptions here, but just the whole point is to show you that if nothing was done, this is how fast it grows, and that's why you're seeing a lot of measures taking place, right? So this won't happen because a lot of measures are being taken right now, so it doesn't double every 3 days. But that's what the politicians and the health experts are looking at to see what's going on, right? And even England yesterday have taken action because they're kind of seeing this trend. Like, you don't want to wait till 200,000 people are infected before you start taking measures, right? So you have to take measures sooner. Especially you have the rest of the world kind of some parts of the world are ahead of us, and you can see kind of what's going on with them. So the mitigation strategy really is to prevent the spread of the disease, and you're basically trying to lower the R naught, right? You're trying to lower the days that it takes to double. You don't want that one person to give it to two or three other. You want to lower that to 1 or 1.5. So that's what they call kind of bending or flattening the curve. And so action needs to be taken, and some of these actions are, limit travel. You still want to isolate, as many positive cases, and you do home quarantine for the mild symptoms. Social distancing, right? You want to stay. You don't want to be too close. You want to close down places of gathering, right? Bars and restaurants, concerts and sports, right? So you're trying to control this infection over time. Now, people will still get sick and people will still die, but the healthcare system at least can handle this, right? And I didn't mention it before, but this virus spreads through something called right now, at least most people believe it's droplet. um, I guess the concern initially was whether this is airborne. Now, the jury's still out on whether this is truly airborne or droplet. But just so that you guys have a better understanding, kind of what the protection equipment requires. If something is greater than 5 microns, the particle is heavy. So if you sneeze or cough, it's in the air temporarily and then it falls to the ground because it's heavy. And then so that's why it's on surfaces. That's why it's on elevator buttons and your hands and money and whatever. And so that's why you hear a lot about hand washing, because most likely you'll get it by touching other things rather than someone sneezing at you. Something that's under 5 microns is more airborne. That means it can stay in the air and float for quite a while. So something like tuberculosis, for example, is airborne. So the level of protection you need is different between droplet precaution and airborne precaution. So we could talk a little bit more about that later, but just want to kind of um, share that quick tidbit. So this kind of bending or flattening the curve, if you look at the red one basically is if you didn't do anything, that's what it is. You have a high rise of cases, and eventually they'll fall. But the idea is to flatten it. So why do we want to flatten it? Well, the reason why we want to flatten it is because the U.S. Healthcare system can only handle a certain amount of cases at any given time. So you want to flatten that curve so that over time you can still take care of them. Now, the area under the curve, for the most part, is still going to be the same. So I don't think people realize that. The area under the curve are the number of people who are sick and have this. But in the first scenario, the area under the red curve, but above the line, are not going to be helped. So those people will have poor outcome, right? Because we just don't have enough. We just don't have enough uh, doctors and beds to take care of those people. Versus the second curve, the blue curve, uh, if it's spread over time, then we can take care of all of them. So that's kind of the theoretical idea of what flatten the curve is. I don't know if people truly understand that, but that's theoretically what's supposed to do. That's the reason for all the social distancing is to flatten that curve. And so if you don't do anything, it's going to be up. But if you start isolating people, if you start closing schools, quarantine, social distancing, then the curve slowly falls and flattens, because again you're decreasing that R naught, right? And that's the idea. The problem is this is a potential problem. Well, it's not potential. It is a problem. The problem is that this might actually be the curve. Our healthcare capacity is so limited that the line is not kind of in the middle. The line is actually low, very low. And then if the number of cases really rise and it's out of control, you're going to have a curve like the red one here, and that's a curve that's a lot harder to flatten, right? anyone can see that. And if you wanted to flatten this curve, you can see the number of days is stretched, and so that's not good either, because there's a cost to flattening the curve. There's a lot of economic downturn, and when you shut things down, that's hard. You can't shut things down for that long of a period of time. So this is kind of the dilemma that we're in right now. So currently, if you look at, and I kind of touch upon this a little bit, if you look at all the data together, what's going on. The fatality rate could be anything from 1% to 9%. It's hard to know exactly what it is. I like to think it's 1%. I like to think that because South Korea and some of the other countries like Germany done a lot of testing, the denominator is higher, and therefore the case fatality rate is actually not very high. It's 1%, and the reason why Italy and Spain is so high is because they're only testing the sick people, and they don't have enough tests, and that's why it's so high. That's my assumption right now. I think that's very likely. But what we do know that is that even with a 1%, case fatality rate, the rates are a lot higher for the elderly and the chronically ill, right? It's very high. It could be very high. 60, 70 years olds are 10+% mortality rate, and 80% of the people that die are older and have chronic illness, and but they do find that some of the people dying are younger. And what's interesting is that at least last I saw, 0% are kids under 9. So, which is very unusual for a contagious disease. That it doesn't affect the young. Um, Overall, 80%. You'll hear this like, oh well, 80% are mild. The young, healthy. You're not going to die 99% of time, or 97% of the time. You're not going to die. You'll be fine. But what people also don't, they're starting to now, is that may be true. You may not die, but 15 to 20% have fairly moderate to severe symptoms that requires hospitalization. And right now, they're showing that in the U.S., 20% of these people that are hospitalized are under 50. They're 20 to 40 something years old, and we're beginning to hear a lot of cases where the young and the healthy are on ventilators. I continue to get those stories from my colleagues and from my friends, which is very shocking that these young people are on the ventilators. Um, People who are okay the first week going to the ER, they have a positive test, they go home to be isolated, and then a week later they come back and they're on the ventilator. Very, very troubling news, and I don't think we fully understand why. And then the other thing that I think we're finding out is a lot of the healthcare workers are also getting sick. I have a lot of colleagues who are very worried, and we're seeing colleagues getting sick. The ER group, the ACEP, American College of Emergency Physicians, which I'm a part of, last week, shared that 2 of the ER doctors are on critical care because of this. This is definitely affecting healthcare workers, and I think over the next few days to weeks, we're going to hear more and more news about this. So, what's going on to these healthcare workers, right? They are in the front lines, and be happy to share some stories with you if you have anything specific. But you have a lot of healthcare providers in the ER and the urgent care and the hospitals. They're working very hard, but the resources are very decreased. There's not enough healthcare workers to handle the volume. There's a lot of people very nervous and coming in. We don't have enough personal protective equipment, and right now, certainly a lot of the healthcare workers are asked to reuse these equipment, reuse the mask, reuse the gowns, which you're not supposed to. I mean, by training, you're not supposed to. This is kind of where this is at the point where the CDC is recommending that if we don't have masks, that we use a scarf or bandana, which is outrageous. If this continue to get worse, there won't be enough ventilators, and there won't be enough beds and ICU beds. I'm hearing stories from some colleagues that some of the uh, hospital beds and hospital wings are being converted to COVID-19 wings, and people are being repurposed. Different nurses and different doctors are being repurposed to kind of help. So there's a lot of things going on, and certainly patients are very scared and nervous, and they're looking for testing and they're looking for treatment. And and we don't have enough tests, and we don't have any valid treatment at this point. And so, we're definitely seeing sick patients die, and healthcare workers are getting sick. Healthcare providers are getting sick. So, there's which leads us to kind of the suppression strategy, which is this is what a lot of people are calling for, and unfortunately, this is something that I think the president doesn't agree with. But the suppression strategy is a real shutdown for a few weeks, and that involves just closing schools and these non-essential and essential services. And basically, the idea is to lower that R naught to below 1. Right? It buys us time. It's going to save lives, but the problem is that it will lead to an economic downturn. Right? When you shut down businesses, there's a there's a lot of consequences as a result of it. So countries like Italy have done it. They've shut down their whole country. England just decided to shut down their whole country yesterday. States like New York, where we're at, Jersey, Connecticut, California, and certainly many other states are shutting down. They're not full shutdowns, but they're basically implementing kind of this suppression strategy where they don't want anyone gathering. And the idea is to lower that R naught to less than 1, so the disease will potentially burn itself out in some places. And the idea is that there's less spread. If you get this number lower, then you can start containing. You can start doing the containment strategy. So this is kind of the thought process. So if you can see that, and this is theoretical, but if you start doing all these things, the R naught starts lowering, right? If you do aggressive testing, you wash your hands, you have travel restrictions, you start closing the bars and the sports and schools, and then eventually you get down to the non-essential, the essential services, the R naught will drop. So that's I guess that's the why behind what all is going on. But this is the cost. Unfortunately, the stock market and economy is dropping like a knife. And even though we had a really nice recovery today, I think it's still going to be pretty bad. So probably not the right time yet. So some people talk about the weather, and I had posted something about this as well. Is this a seasonal thing? Could this get better? And I think the answer, we'll see, but the answer is potentially yes. There was a study done that showed that if you look at the epicenters from January and February, it's located in these areas, right? Seattle, Milan, Italy, Iran, China. And what they found is that they all had similar temperatures between 40 to 50 degrees Fahrenheit. And they had a relative humidity from, I think it was like 50 to 70 degrees, 50 to 70% humidity. So there may be a pattern. Maybe their guess is that this virus survives longer, during that temperature. And if it's too hot, it doesn't survive on the surfaces, and it doesn't survive that as long, right? We've all seen studies where this virus can stay on stainless steel and plastic for about 3 days, and on cardboard, I think it was like 24 hours. But in warmer temperature, it significantly drops. That can be said also for colder temperature, right? So it's possible that if you look at New York, it was 0 degrees during this time. That's why it didn't spread in New York in January and February. And when I was busy trying to figure out what was going on during Chinese New Year, there weren't really any cases. But now, as we get warmer and we're in the 40 to 50 degree range, and many other cities are, getting warmer and falling into this range. Now there are new epicenters. So, New York, London, some of these other northern cities are going to get hit harder. That's the theory. And so far, it's looking like it's true, right? Now, this also suggests that there will be lesser cases in the warmer countries. Like you don't really see a lot in Brazil or Africa. You're going to see a lot in Florida and Australia, but the reason for that, I think, is because people travel there. A lot of New Yorkers go to Florida, so that's why the Florida numbers are pretty high. And I would say the same thing with Australia. That's a place that people do travel to. But if you look at South American countries, if you look at South Eastern countries, it's a fair argument to say, well, why isn't Thailand and Vietnam and Taiwan and Singapore and Philippines all like they're so close, right? So maybe part of it is certainly part of it is the containment, but maybe the weather has something to do with it as well, like India too, right? So hard to say, but that's kind of the theory. And in the colder countries, when they're still at 0 degrees, they're not getting it yet, but as they warm up, they will. Like you don't hear too much about Russia and some of the northern European countries yet. So this could be something where eventually it becomes seasonal, where there's certain months where it's more prevalent, and then once it's fall here and summer in the southern hemisphere, maybe they get hit with it. Remember, this is not going to go away because we have no immunity, right? At least not yet. Some of the people who recover will have immunity, but this will go around the world. So, this will take some time to play out. So I think the things to look for, people talk about cures. How do we get better? Immunization is certainly one of the things you have to look at. Antiviral medications and other medications. There's two types of immunization. There's the active immunization, which are vaccines, and those time. Passive immunization is being talked about a little bit more, where they take the antibody from people who've had it and they try to give it to people who are suffering now, and that may help. I don't know enough about whether it's working or not, but I do know there's a lot of trials on that. Antiviral are medicine that are targeting viruses. So Gilead's Remdesivir, this medicine is being used for more severe cases in the hospital. It's not made for that, but it's being used. Kaletra was an HIV medicine that was used, but I think recent study has shown that it's not working as well. And I'm sure everyone's heard about these other medicine like hydroxychloroquine with a Z-Pak. Not sure if this works. Hopefully it does, but the study was based on 20 people, so it's hard to say that's a cure. Study on 20 people, right? But unfortunately, people jump on this, and now if you're trying to get a hydroxychloroquine, it's all back ordered in New York. You cannot get it in the pharmacy. ARB, which is angiotensin releasing, it's hypertension medicine, may or may not work. Hard to know. And then there's a lot of other things that people are testing. So, we'll have to see what happens, but definitely a lot of trial going on. But, general rule of thumb is there's no easy cure. Now, we could get lucky, but we shouldn't, bank on that. So some general advice from the CDC, initially when things weren't so bad, they just gave us advice on cleaning, disinfecting, avoid touching your eyes and nose if you're well, and only if you're a healthcare worker or if you're sick, and hand washing, right? Wash for 20 seconds, and then cover your nose when you sneeze or cough. You still have to do these things. These are just general advice. But now, because of what's going on, the advice now is to stay indoors, social distance. Only go out during essential needs, especially in New York. Some of the states are locked down, like New York, California. Some of the other states are not, but you should still practice social distance. Continue the good hygienes, like mentioned before. um, but more importantly, if you're sick, what do you do? Well, the recommendation now is if you have mild symptoms, just stay home. And why is that? Well, stay home. You can use telemedicine or just kind of, treat with over-the-counter medicine. But if you stay home, it helps lower the amount of equipment that's needed. And because there's a shortage and uh, there's not enough, we need to conserve those PPEs for really sick cases. And it also lowers the ER and hospital beds being used, right? There's a shortage of those. And there's definitely going to be sick patients. And so if you have mild symptoms, the recommendation is just to stay home. Now, only go to the hospital if you have, moderate to severe symptoms, right? Shortness of breath, difficulty breathing, that type of thing. I think last, just a quick advice for those who are still open for business. General recommendation, basically, just have, you want to take care of your staff in this, in these times. Make sure they're washing their hands. They're using alcohol-based sanitizer. Temperature checks twice a day. If someone is sick, make sure let them stay home. They should really be free of fever for 24 hours before returning to work. And then just routine environmental cleaning, right? Workstations, countertops, keyboards, remote controls, and things like that. All right, that's my quick presentation. I try to cover kind of broadly about a little bit of everything, and be happy to answer your questions. I'll do my best. Yeah. So, question is, what does recovery look like? I hear there's loss of lung function for severe cases. Yeah, we hear that too, but I don't think at this point anyone fully knows. I think this is based off the old SARS. First of all, this is called SARS. I think this is also labeled SARS, so don't get nervous. But the first SARS, the deadly SARS, I think they've noticed that some people had decreased lung function, so that's why uh, they surmise that it's going to be similar. We don't truly know yet because it's such a. If you think about it, it's only been 2 months, so how can anyone really say there's loss of lung function, right? If you're sick and you have pneumonia, it's very normal to have loss of lung functions for a period of time. So are these things permanent? It's hard to say. Hopefully not. And your second question, let's see, second question, do you have an opinion uh, whether antibody dependent enhancements may make any conventional vaccine impossible and may explain why wave 2 reinfection really knocks out young people? Not sure what that means. uh, Antibody dependent enhancement may make any conventional. Well, I'm not an expert in creating vaccines. I'm not, an expert on kind of immunization. So all I can really comment on is that um, the ultimate way for this, the ultimate cure is for us to have herd immunity, and there's only one or two ways for us to get this, right? Either we all get infected and we develop antibodies, or we have a vaccine that uh, you know gives us resistance, right? And we develop antibodies that way. Um, so that's the kind of the vaccine question. I don't know how long or how a vaccine is created. I'm not an expert in that. But they're using antibodies now to treat the critically ill because they have nothing else to give them. So why not try this? And that's basically what a lot of these medicine and a lot of these trials are, right? If someone is critically ill, they're just going to throw the whole kitchen sink. And we do know that when you are infected, you develop an immunity. So maybe those antibodies, if they can, uh, if they can get those from donors, maybe that's a way to treat it. Wave two, your second part of your question, wave two reinfection. Not quite sure what you mean by that. It's really puzzling why, how, if you're talking about young people, I mean, right now, kids and infants and babies are not really, um, they might be infected, but they're not sick from it, which is a blessing, right? So no one can really explain that. I think someone had mentioned to me that the virus attacks ACE2 receptors, and that's between adults and kids. There's a variation. There's a lot more in adults and less in kids. I don't know if that's true, but that's what I've heard. I'm not sure what you mean by wave two reinfection. What's your advice on masks and eye protection? So this goes back to precaution, right? So um, so let's start with the basic. If you're a healthcare worker, if you are dealing with someone with potential airborne, um, you know, uh, s- someone who has a disease that's airborne, then you really need the proper protection, right? Which includes a N95 mask, because the N95 mask will prevent the smaller particles from entering. And you also need eye protection because the way it enters is through the mucosa surface, your mouth, your nose, your eyes, right? So that's why you'll see that all the ER doctors and all the uh, nurses and staff at the front line, whether it's urgent care or ER, or if they're dealing with these patients in the ICU, they're wearing N95 masks. They're probably also putting a surgical mask on top of it, so this way they don't have to replace the N95. And they're wearing eye protection. That's more for the airborne. And then they also wear the gowns for contact isolation. Contact isolation or droplet isolation is, like I said, is when those droplets fall to the ground. If you touch it, um, usually find them on surfaces. So that's why they wear the gowns and then the gloves. So, but for the normal person, I'm assuming you're asking about the normal person. For the normal person, what about masks and eye protection? So it all depends on the setting, right? So if you're just walking around, you really don't need anything. Um, the normal surgical mask does not really protect you from uh, it protects you if someone sneezes right in your face, right? And if, but it, and it once again, we have to really find out if this thing is airborne or droplet. If this thing is airborne, then the surgical masks don't help. And that's the bottom line, right? And if this thing is droplet, which is what everyone's saying, um, then yes, potentially can help a little bit. But the problem is most people don't know how to handle a mask, and they touch the mask all the time to adjust. And the masks are meant to, these personal protective equipment, these masks are meant to be used very short period of time, even the N95, right? So when we use the N95, when we see a patient with tuberculosis or something very contagious or measles, you go in the room, you wear the mask, and then after you're done, you take it off and you throw it out. These masks are not meant to be used for prolonged period of time, rarely used. So, so for the normal, common, everyday person, there's definitely a little bit of a security blanket wearing the mask. But if you were sitting next to somebody who was contagious and he coughed, that probably will not give you as much protection as you'd like it to be. So that's kind of the short answer. Let's see another question. In the long term, will everyone need to be vaccinated, or will it evolve and we will need annual vaccination? And with people that have it, will they have immunity? Hard to say. So the coronavirus is actually, there's a lot of different coronavirus. There are actually 4 coronaviruses that most of us have already had. These are your common colds. Um, and so this is just a mutated, deadlier coronavirus, just like the SARS. And so I think the thought is that once you've had it, then you should develop some sort of immunity and should be fine. Again, if let's say 80 to 90% of the people have it after a year. Let's say this thing spreads like wildfire and we did nothing, and 80 to 90% of people have it, um, or maybe even less, and then a lot of people die. You will build enough herd immunity so that it doesn't spread as fast the next year or the following year, right? You get it? The reason why the flu mutates and changes quite often, so that's why you have to keep changing the vaccine quite often. And it's never 100%. Um, yeah, there's definitely mutations. Some people, I've read report that I don't know which one's deadlier, but some people mentioned that the one in Italy is more deadly. Hard to say. Who knows? But these things definitely mutate. When you have enough sample size, it will mutate, and I think it already has. And so it remains to be seen, whether we will have immunity to the whole thing. Um, it depends on how the vaccine is created and what it does, and then also depends on if you have any medication for it. Okay, how slow should the number of daily new cases be for us to know that we're at the inflection point on number of cases? uh, Very tough question. Give me 1 second. Sorry, that was my dog. He wanted to get out. uh, it's a tough question because in the U.S. we haven't done enough testing, so we don't really know where we're at. So if you don't know where we're at, it's hard to know where you need to be, right? So you can, if you can falsify some of this data, right? There was a time when I was really angry and upset because every case we called, the DOH would ignore testing. So it made the number look it made it look lower than it really was. So in January and February, when they gave us guidelines, and when you're calling, the guidelines were so strict that they were rejecting. And then even if you thought you had a slam dunk that you would get the test, they still rejected it. So that's why it looked like, oh, there's only a few people infected. I mean, do you know how many people they tested uh, in the month of February? You'd be shocked. They only tested 8 people in New York City. So that is abnormally low. So basically, there's no, it's not blaming anybody, but there's a lot of issues. Obviously, they had lab issues, and they had a very strict criteria. Hopefully, none of this stuff was politically motivated, but that's the problem with statistics and data. If you don't have true data, you don't know where you're at, and you don't know where to get to. Right? The biggest challenge that we have now is we don't know what our true numbers are. What we're seeing now is actually not our current status. So I had some exposure and I had some symptoms, and so I had a test. It took 9 days for it to come back. So the numbers you're seeing now, are from a week ago. Now they're going to have more rapid testing, so it can come back maybe 2 to 3 days. But a lot of these things are from a week ago. So, and they haven't tested everybody. So, I think the numbers of infection is actually a lot higher. And so it's hard to know. So once we get to the point where we're really testing everybody, and I think we're almost there because they're approving some of these non-FDA tests, and and the labs are finally figuring things out and having a fast turnaround time, then you're going to start seeing these numbers rise. And then I think once you start seeing the number of new cases start to plateau, uh, then we can kind of surmise maybe we're at that point. The number of deaths, though, is always delayed, right? Because from what we've known, there's an incubation period for 2 to 14 days. Some people don't get really sick until later on. Just from my friends telling me they've seen somebody with mild symptoms that were tested positive, sent home. A week later, come back, young guy, 40-year-old, needs to be on the ventilator. So you might see that some of these people who are positives, a few days later, just crash and get really bad. So, I don't think we know yet, and I think that's part of the point. A lot of the healthcare experts are just baffled that we're just so underprepared. You can't tackle a problem if you don't know how many cases there are, and this way, you can't make good decisions if you don't have that data. And if you stop testing, which they are right now, if you look at some of the CDC recommendations, it is baffling to me how they're making some of these recommendations. Now, part of it maybe is because we have shortages, but they don't want to test anybody that it does not require to be hospitalized. So that is going to skew the numbers. And if you are a healthcare worker and they don't even want to test, if you're a healthcare worker with symptoms, they don't even want to test you. That's kind of at the point we're at right now. So yeah, it's hard to say how slow the numbers should be unless we have some accurate data. And I thought we were kind of going that right direction until recently. So let's see another question. Do you know how come some people can be tested positive, have no symptoms, and how do they know 14 days is enough for quarantine? Uh, yeah, I mean, I think we're finding that the majority of the people have mild symptoms, or the majority of people that are positive have mild symptoms. Certainly, there are people who have no symptoms are positive. How did they get the test? If that was a question, that's maybe it's just exposure, right? So I think we're learning that there are people who test positive and have no symptoms. There are a lot of people who test positive that have very mild symptoms. I can tell you that in New York, from the labs and from the contacts I have, about 30 to 35% of the swabs tested are positive, and majority of these people have symptoms. So that's kind of the rate. Do we know 14? How do we know 14 days is enough? We actually don't. That's kind of the assumption that after 14 days, this will be fine. I think this is just based off anecdotal evidence from all the places before us, that if they quarantine in 14 days and they're fine, that you don't have to worry about it. I think right now it's safe to say that's okay, but I think the reason why they say that is because they found people with symptoms, uh, between 10 to 14 days later after exposure. So that's why they're giving it kind of a 2-week. They're assuming that there could be up to a 2-week incubation period. So after 14 days, if you don't have symptoms, they just assume that you are fine. Is it possible that you have it and you're a carrier, but you have no symptoms? Sure. And I think kids, certainly children and other healthier people, could be carriers, and that's why it was important to shut the schools down. If you were sick a couple months ago and recover, is there a way to test to see if you had COVID-19? Great question. So some people ask me about that they had flu-like symptoms and had a very bad cough or didn't feel like the flu. They want to know if they had coronavirus. there are new tests coming out that tests for the antibody. I saw something recently. I'm not sure if I don't think it's approved yet, but it will. I think it's coming out soon. So at some point, we'll be able to test if you've been exposed and if you had it. Because it tests for the antibody, it tests for IgM and IgG. So it just tests to see if you've been exposed to it. So the answer is yes, we'll have it. But is there a way to test it now? No, because we don't even have enough tests to see if you have currently have the virus. All right, here's another question. When countries test, do they have an obligation to report to the global totals? Asking because India just locked down for 3 weeks, even though they don't have that many confirmed cases report. You like to think they do. They're supposed to work with the WHO, the World Health Organization, and they're supposed to report accurate data. But the conspiracy theorists and all of us probably assume that the data from China is not accurate, right? I think most people feel that, especially from the media and from what we're seeing on social media, that the number of infection from China is not accurate, and so now I'm hearing that maybe Russia is doing the same thing, and other countries are doing the same thing. And if you're really kind of thinking as globally, um, would a and this is just hypothetical, but if you're the leader of a big country, would you want to scare everybody? So would you encourage lots of testing, right? So um, you never know. You never know what each of the country's leaders are thinking, but you like to think that the scientists and the healthcare experts there are reporting this to the WHO, and that the data that we have is accurate. But I don't know enough about the obligations. But obviously, you're going to have countries that don't report anything, and that's not true, right? All right, here's a practical question. What should we wear to go grocery shopping? How do we sanitize food that we bring home from the grocery store? Um, let's see. What's the best way to answer this? So when you go grocery shopping, the risk is that you have two risks, right? The first risk is that you're going to get in contact with somebody that is infected, and they sneeze on you or cough, um, and you're kind of in that vicinity. So that's number one. And then the second risk is that they they touch something that you're touching. Right. I think the biggest risk is really the touching. So when you go shopping, what's important is that you do need to, once you're done shopping, you do need to wash your hands thoroughly. You want to, if you're touching your car or touching doorknobs after you get back, you want to clean that, because there's a high chance that that's you're bringing something in. So that's important. Um, when you go grocery shopping, and then when it comes to just being near somebody, obviously you want to just have social distancing. You don't want to be too close. You want to wear the mask, that's fine. I mean, there's no harm in wearing the mask, right? So I encourage people to wear a mask. I don't think there's anything wrong with it. I think the Asian culture is fine with it, and in the U.S. and in the European culture, it's not as it's not as not necessarily the norm, but I think you're beginning to see more and more of that. In terms of sanitation of the food, I guess it depends on what you're bringing, but the virus doesn't the virus stays on the surfaces that are not porous. So plastic and steel, they can last for quite a long time, like 3 days. Cardboard box is 24 hours or less. Anything more porous than that doesn't last. So yeah, I mean, if it's a fruit, yeah, wash it. I don't think there's anything special. If you're concerned, I think that's That's probably all you need to do. Just wash it. When you cook it, the heat and all that stuff should kill the virus. Anything in the can, anything in a box, I think you just need to, you know, have some awareness that maybe someone else touched the box, and then so you may want to just wash your hands afterwards. Um, all right, let's see. If you are asymptomatic, should you still avoid contact with the elderly relatives? The short answer is yes, because um, you, you could still be a carrier. And that's, you know, I think the majority of the people could be carrier. They can have mild symptoms, or they might say, oh, it's my allergies. So they don't think it's a symptom. And so what we do know is that elderly relatives who get this could be very dangerous. So personally, I wouldn't risk that. All right. Um, how long would it take to develop trials, tests, studies to figure out if natural immunity is permanent? Yeah, I'm not an expert in this field, so that is something I don't think I can answer or address. But my understanding is that any sort of trial and tests and studies usually take quite a long time. You need consent. You need it. There's a lot of red tape. Now they're removing a lot of that stuff, so that's the good news. But hopefully, we're not. We're not. Hopefully, we're not rushing to a cure, right? Because that's the downside. Sometimes you rush because you're hopeful and you look for results that you want to see, and you ignore the danger. So that's my fear is that yeah, they find something they think it's going to work, and it actually ends up killing people. And they had a lot of these. I've heard of a lot of things like that during HIV and during other things where they thought this was a cure and ended up harming people. So um, there's a reason why things take time and why things require trials and studies. I don't know how long. I mean, I guess it varies. Uh, and I don't know enough about the antibody stuff to answer the other part. Is it safe to run outside? Should we wear a mask outside? This depends where you are. I guess the short answer is yes. It's safe to run outside, and actually, some of the states encourage you to run outside. In England, you're allowed to do one exercise activity a day. um, Remember, this thing's not, from I mean, except for a few mention of this shouldn't be airborne, right? Now, which means that if you're in the park, it's not like this is a gas and it's floating around for you to breathe, right? So you're fine. If you're not touching anything, you're running around, you're fine, right? You're not breathing this stuff in. Um, should you wear a mask? I think again, the mask doesn't hurt to wear. It just it's meant to kind of shield you from, because the surgical mask just really shields you from direct contact, right? So if someone is sneezing or coughing, it's meant to be a shield to prevent that from going to your face and going to your nose. That's really what those surgical masks are made for. That if you're a surgeon, or you're a doctor, you're doing something. If something splashes, that it catches that. It's not meant to filter. It doesn't have a filter, right? The N95 has a filter. So if uh, the N95 is hard to wear. If you ever wear N95, it's hard to breathe in that because it's filter, right? You're kind of breathing through a straw. This surgical mask is far from it. So if something was airborne or if someone was coughing, and you'll catch the droplets, but God forbid this thing was airborne, then the surgical mask is really of no help. But I don't think that's the case. I don't think that's what everyone expects. So that's why the CDC is not recommending masks for people who are well. They're actually, it's really more social distancing and washing your hands. Um, Again, you know, wearing the mask doesn't hurt. The mask is actually more helpful for people who have symptoms. So you got to look at the other way. So if you're coughing, then you should wear the mask because that prevents the droplets from coming out. So, you know, if in the Asian culture where everyone wears a mask, that works because it's actually preventing the people who are sick from spreading it because the mask is acting as a barrier. It's to prevent things from coming out versus prevent it from coming in. Okay.
Okay. Thanks so much, everyone, for joining us. Thank you, David, for joining us as well and taking all the questions. Everyone's thanking you on live chat as well. We really appreciate you taking the time. No, you're obviously super busy right now given everything that's going on. So appreciate you sharing your knowledge. And everyone, thanks so much for joining and being engaged and asking a lot of great questions. Like Dave said, please, stay safe, stay at home, keep healthy. There's a lot of things to kind of do at home right now. So, just really try to help flatten that curve for all of us. And then we have some more lighthearted events coming up. So we have our virtual tappy out on Thursday. Join us there. We'll be doing the census together. So for those of you who haven't filled it out, we'll be able to answer any questions you have, and then we can also complete it then. And then Friday, we'll do a little Netflix party and watch a rom-com. So to end your week, hopefully on a little bit of a lighter note. But again, thank you so much, David.
Thank you. Yeah, it was a lot of fun.
Cool. All right. Thanks, everyone. Have a great night.
Thank you, guys.